Mercy Ascot's one-stop neck lump clinic is about to celebrate its first-year anniversary after opening its doors in February last year. Located in Takapuna in Auckland, the clinic has seen almost 100 patients, reducing their diagnosis waiting time from weeks to less than an hour. We talked to Mark Izzard and Rajan Patel, the two head and neck surgeons who spearheaded the clinic. We first asked them what was their inspiration for the clinic.
The inspiration behind the service was really born out of frustration that current patients were having to wait quite a long time for their diagnostic tests and to see specialists. And so the idea behind the clinics were really ones to try and speed that whole process up. So the minute a GP sent the patient to us, we'd know that within that first clinic appointment they'd have the diagnosis and we can start planning their management.
Do you mind giving me a bit of a background on what's the traditional journey of a patient is like after being referred to by the GP?
So initially a GP would send a referral letter into a specialist concerned about a lump in the neck. There would then be an initial delay until the specialist saw them, anything up to a week or 2 weeks. And then the specialist would examine them and, if appropriate, send them off for a test, usually an ultrasound scan, maybe an ultrasound FNA.
Well, the unique part of our service is that all of the specialist resources and facilities required to assess and provide a diagnosis for a patient with a neck lump is available at one clinic visit, and typically that visit lasts anything from 30 to 60 minutes. So the services available and that are necessary to establish the diagnosis for a neck lump are a clinical assessment, typically performed by a head and neck surgeon, a radiology assessment, which is essentially an ultrasound test performed by a radiologist, and a pathologic assessment, which is an interpretation of the tissue extracted during the biopsy by a pathologist.
So what kind of information is passed on to the GP after they actually come here?
So when the patient leaves the clinic, a full report is produced which outlines all of the assessments that have been performed at the clinic, and those are clinical assessment, the radiology assessment and the pathology assessment. So essentially the GP is provided with a full, with all of the results, including the diagnosis and the treatment plan. There's a letter that goes out electronically, so within 24 hours of the patient being seen, the patient has received communication.
So what kind of red flags do GPs need to sort of look out for?
So any patient with a new neck lump that's persistent for more than 2 weeks is an immediate red flag. Patients who have a neck lump and associated other symptoms, head and neck symptoms, including pain in the throat, difficulty swallowing, change of the voice, risk factors associated with the neck lump, including smoking and heavy drinking. Those are typically patients that we're interested in seeing rapidly.
Yeah, how much does the consultation cost?
So this service is a private service, and patients who attend the clinic are typically insured. So a initial consultation with the surgeon costs $250. If the patient requires a nasendoscopy, which is an assessment using a fibre optic light passed into the nasal passage and throat, there's an additional fee of $200. And then there's a fee of $650, which relates to the ultrasound and finally lacerate biopsy. And the pathologist, there's no fee for the pathology component. So all up, the fee for attending the clinic to establish a complete diagnosis is anything from $600 to $1,000.
Why do you think head and neck cancers deserve their own sort of clinic of their own?
Because head and neck cancer is one of those things that's traditionally not particularly treated very well, and the reason for that is because they're in places that are hard to see. So, if you get a cancer in the tonsil or the back of the tongue, oftentimes the first time you know about it is when it presents with a lump in the neck. Breast cancer, there's a lot of awareness about it. Bowel cancer can cause symptoms. Oftentimes these tumours can get to quite a large size before they actually cause anything wrong. And oftentimes that neck lump is the first thing that you know that's actually the physical manifestation of the tumour in the primary site. Also, it's quite a complicated thing to treat. and it requires what we call multimodality treatment. So often it's surgery, chemotherapy, radiotherapy, and all these things have got to be really tightly coordinated. And so you have to be, there's no role for lone players anymore in head and neck cancer. It's a multidisciplinary service. And so Rajan and I are only a part of the team that we have around us, both in public and private, to provide that service. What the patients don't need is they don't need a 6-week to 2-month delay before they get their diagnosis and treatment plan. That really needs to go away as soon as possible. And that's certainly what's happening, as we know, within the public sector.
Have you sort of approached DHBs with this idea?
Listen, it's pretty hard to get the current wait list for an ultrasound and the DHB is up to 8 weeks just for the scan. So trying to get an ultrasound FNA can take up to 2 months at the public hospital, let alone trying to get a pathologist to come along. As you know, DML has just been amalgamated into the public sector, and so it's proving difficult to get ultrasound guided FNAs in a timely fashion at Auckland Hospital. I can't speak for the other DHBs. Certainly, we can offer this service within a week of the patient being referred, they've got their answer in their management plan.